This is Heart Rhythm TV, and I am Julie Shea here with another episode of Advancing Allies. Today we're here to talk about the AF Playbook. Now, atrial fibrillation is a complex condition to treat and oftentimes requires a multidisciplinary approach. With me here today, I have Dr. Elliott M, who is a professor of medicine at Harvard Medical School and a general cardiologist at Brigham and Women's Hospital. And I also have Andrea Lewin, who is a senior pharmacist at Brigham and Women's Hospital as well. And Elliott was the lead author on the AF Playbook, which was developed in collaboration with the Heart Rhythm Society. And it was also published on CardiQ. So can you talk a little bit about how this all came to fruition?
Well, thank you very much, Julie. It's a pleasure to be here. The management of AF, as you point out, is often fragmented. It occurs across multiple specialties. And the chronic nature of the driver conditions that predispose a person to atrial fibrillation, coupled with the increasingly complex treatment approaches, make it difficult to deliver this care without coordinating it in some fashion. And that's what an atrial fibrillation center is all about. The Heart Rhythm Society emphasized in a white paper several years ago the importance of an AFib Center of Excellence. And now with the publication of the Operational Playbook, healthcare providers can refer to the CardiQ website, look at the playbook, and they have a toolkit that will give them templates and examples of what they should be doing if they want to set up an AFib Center of Excellence in their own institution. And we hope that by doing so, they will lead to more efficient patient care, better patient satisfaction, and as we all hope, much better patient outcomes in atrial fibrillation.
Yeah, absolutely. I mean, I did take a look at it, and it's a great document that provides this kind of step-by-step approach for developing this program. And, you know, I think people can look at their institutions and kind of see what areas need to be further developed in terms to make this happen. So can we talk a little bit about the role of the champion or a team of champions? Is it essential to have a champion involved when you're looking at putting together such a program?
It's a great question. Institutions vary with respect to their available resources and what kind of support is available when one is considering setting up a center of excellence. So in the beginning, it may be a small number of resources that are deployed, and it can grow. But this all starts with a champion, a person who's committed to the principles of AFib Center of Excellence. Now, the AFib Center of Excellence champion can be a nurse practitioner like yourself, a general cardiologist like I am, or it could be an electrophysiologist. Ideally, the person who is the AFib Center of Excellence champion should have deep domain expertise and absolutely committed to the spirit of setting up a center of excellence.
Absolutely. So can you describe the importance of the 4 pillars of the AFib Center of Excellence, this framework that in order to establish a credible AFib clinic?
Sure. Another really great question. The 4 pillars of AFib management, as you know, are risk factor management, stroke prevention, rate control, and rhythm control. And much of the discussion to date has focused on selection of the proper antithrombotic therapy for stroke prevention, AV nodal blockade to make sure the ventricular rate is controlled, and use of antiarrhythmic drugs or ablation techniques for rhythm control. It's very important to realize that we now have evidence that risk factor management is associated with a reduction in the burden of atrial fibrillation, and that is whether or not the patient has paroxysmal or persistent atrial fibrillation, and the patient's quality of life is improved if we do improve their risk factor management. Now, a lot of this is handled in collaboration in our center with our pharmacists, such as Andrea. Can you explain the program called CDTM, what that means, and how we were able to set that up here in Massachusetts?
Yeah, absolutely. So Collaborative Drug Therapy Management, or CDTM, is the program that all of our pharmacists practice under. It's well established that we do this type of work in an anticoagulation management service, but really expanding to rate control management and antiarrhythmic drug surveillance was the next natural step for us. So.
Yeah, absolutely. I mean, it's interesting. So I've talked to other people that have put together AF clinics or AF Center of Excellence, and It's very interesting that, as you mentioned, Elliott, sometimes there's the nurse at the hub, but I think it's the important point here is that you have a point person that kind of is in the hub and kind of driving this person through this systematic approach.
Yes, it could be a single individual, it could be a network of individuals who together work as a team to be the champion for that AFib Center of Excellence.
So what are the common challenges an organization may face when trying to set up a center of excellence, and how does the playbook address that?
So when folks are trying to set up an AFib Center of Excellence, they may have some trouble just knowing how to start. And the Operational Playbook provides examples, templates, so that they can think through the different perspectives they need to consider, the patient perspective, the institutional perspective. They can also set up their communication pathways, the referral pathways. These are very important, and by providing all these tools in the Operational Playbook, our hope is that we can overcome the activation energy that's needed to actually get started and set up an AFib Center of Excellence. And by doing so, we hope that we're going to see improvements in the care for this very important and increasingly prominent medical condition.
Yeah, absolutely. So how can people access the playbook?
The playbook can be accessed by going to the CardiQ website, and you can read through it as a book, or you could go specifically to the chapters. There are 16 chapters, and you can go to the specific chapter where there may be material that you just want to focus on, whether it's how to set up the pharmacy referrals, how to obtain electrocardiographic confirmation that a patient actually has atrial fibrillation, how to organize the referrals to electrophysiologists, to cardiac surgeons. So there's lots of material there, and I know you've contributed some of the educational material there, which is extremely helpful.
Yeah. So how do patients get referred into your Center of Excellence at this time?
So our patients would get referred in through their primary care doctor. They may be seen in the emergency department. They may be found during routine monitoring for a procedure that has nothing to do with their heart, and as part of the monitoring they're discovered to be in atrial fibrillation. So a variety of those pathways, and we actually outline in the playbook all the various pathways and think about exactly what you need to do, who you need to set up those communication pathways with. The emergency department, primary care doctors. We did actually write to primary care doctors. We introduced them to the pharmacy team and explained what would be provided if they referred their patients into the AFib Center of Excellence.
That's great. So, I mean, it's really such a great playbook that, you know, kind of no matter what environment that you're coming through, you can kind of tailor it to meet the needs of your particular organization.
Yeah, it's extremely helpful, and people can, as I say, read it as a book, or they can go to specific chapters. One of the things that I have felt was the secret sauce for our success was our collaboration with our pharmacy team. So could you talk a little bit about how you use that CDTM model for antithrombotic therapy control, rate control, and antiarrhythmic drug management?
Yeah, absolutely. The pharmacists work within the CDTM protocol that we described earlier, and that's for anticoagulation, for rate control, and as well for antiarrhythmic drug surveillance. For anticoagulation, including warfarin and our direct-acting oral anticoagulants, the pharmacist serves as the point person for selection, initiation, education, assessment of adherence, managing drug interactions, procedural or surgical management, and long-term management, providing ongoing care, and just being the point person for any questions that the patient might have. In addition to that, with a CDTM program, the pharmacist can order labs like PT-INR or serum electrolytes and do the actual writing of the prescriptions. Similarly, for rate control, again, this is a CDTM program. So the pharmacist is able to initiate, educate, titrate the rate control agents, and again, order necessary lab work for routine management or surveillance of the drug itself. In addition to writing the prescription, so that's a big plus.
That's great.
For the rhythm control piece of that, the pharmacist really provides active surveillance. So we're not initiating the agents, but what we are doing is ensuring that we're managing for any drug-drug interactions, that we are looking to make sure that there's proper laboratory follow-up, making sure their patient's getting their electrolytes done every so often. There's also other monitoring parameters that the physician may order, but the pharmacist is going to screen and make sure that that's being done as well. For example, EKG, and making sure that the QTC isn't prolonged in certain situations as well.
That's great.
Yeah, Julie, I want to bring out one other point. We put into the playbook a diagram, sort of a bullseye diagram, and at the very center of that bullseye is that AFib Center of Excellence champion that we referred to, and then there are concentric rings around that. The closer one is to the center of that bullseye, the tighter the relationship for the day-to-day running of an AFib Center of Excellence. But there are concentric rings that go out more to the periphery, and while they may not be as tightly involved in the day-to-day running, they're still very important services that should be available to patients who come through the AFib Center. You mentioned sleep medicine, because we've found that there's a lot of sleep apnea in patients with atrial fibrillation. And I think that we ought to consider that bullseye diagram as a platform to think about how to implement management according to those 4 pillars that we discussed a few minutes ago. It's really a nice relationship.
So it all
with those
pulls
two
it
diagrams.
together. Yeah, absolutely. Great. Well, thank you both. Thank you, Andrea. Thank you, Dr. Antman, for coming to chat with us today about the AF Playbook. And I would encourage you to look on the CardEQ site, check out the AF Playbook. This is Julie Shea for Heart Rhythm TV.